Good Monday morning, everyone. It is February 28th. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook, YouTube, and on Twitter. Coming up this morning, you may know him for his humor, but things turned serious for one popular actor. He joins us live this morning to talk about the treatment he underwent for his heart and lung right here at the University of Kansas Health System. Plus, we'll talk with his thoracic surgeon about the treatment he received and how he's doing today. In medical headlines this morning, a new review of 15 studies by the United Kingdom Health Security Agency shows COVID vaccination does protect against developing long-haul COVID symptoms. In fact, researchers say those who received 2 doses of the vaccine were half as likely to develop COVID long haul. When it comes to COVID boosters, a new study from the University of Pennsylvania finds you may not need to get a 4th shot after all. Researchers say once you get that booster shot, it prompts the body to make a variety of antibodies, making it difficult for any variant of COVID to escape. Although people over 65 or at high risk may benefit from a 4th vaccine dose, the CDC is not necessarily pushing for it anytime soon. Women considered obese are more likely to be diagnosed with COPD. Researchers in Korea say the excess weight causes the lungs to become inflamed, leading to asthma, which can then lead to COPD. The study was limited, though, and exclusive to women in South Korea. Get your questions sent in to us on YouTube, Facebook, and email them to the Medical News Network right there on your screen. We'll get to those in a bit, but now let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count. How are we doing coming out of the weekend? Good morning, by the way.
I mean, I think we're still doing fairly good. Again, a lot better than we were 2 weeks ago, 10 days ago. Our active infections are continuing to be in the 40s, but low 40s right now. And again, we're looking at those overall trends, 7-day, 10-day trends. Right now, we have 43 active infections with 4 in the ICU, 3 on the ventilator, so a large proportion, obviously. 72 patients in that recovery period, so a total of 115. But overall, Steve, I think it is great that we continue to see the trend of hospitalizations decreasing.
Okay, I agree. We have to remember, though, that the reality is we're still high relative to where we were last spring at this time, a lot higher. And I think we have to be careful with some of the new masking guidelines coming out of the CDC. That is really good news. The United States is doing better. We have more people are vaccinated. A lot of people have natural immunity. And so we're in a little different place. But the guidelines ask you to look county by county across the country to see which zone you're in. Are you in the yellow zone, the green zone, which means all things are great, the yellow zone, or the orange or red zone? Here in the metropolitan area, both Wyandotte County in Kansas and Jackson County in Missouri are still in the red zone, which means you should still be masking in all indoor public places. It doesn't mean this is a get out of jail free card. Yeah. It doesn't mean that masking has ended. And that, unfortunately, is how I think people have interpreted it. I was at a couple stores over the weekend in Jackson County, and I noticed a few folks just kind of out there, nobody's wearing a mask anymore. The mask, they said you could take your mask off. No, actually what they said was, if you live in an area with lower disease transmission, and very importantly, because the strongest variables the CDC now relies on as we move to live with COVID-19 as part of our recurring infections and recurring things we have to be concerned about, they looked at hospitalizations, but the percentage of patients who are coming in, and it has to be like less than 10%, or you have to have less than 10% of your beds occupied by COVID-19. By the way, we still have more than 10% of our beds occupied by patients with COVID-19. So I think at the end of the day, what you would have to say is we are still actually in the red zone in Wyandotte and in Jackson County. Johnson County is in the intermediate zone, which means if you have underlying chronic disease like significant COPD, like we just heard about, obesity, diabetes, immunosuppressed illness, et cetera, or you're around loved ones and family members, you should still leave your mask on. And finally, if you're really in the green zone, take your mask off, including all schools, et cetera. Hawk. So it's easy. If you go see the CDC tracker, it'll take you right to the website to show you where your county is.
Yeah, I think that's important. We've always said you're always as strong as your weakest link. I think in this case, you are in the same category as your highest category, because we are so integrated and so dependent on one another, especially in these core four. So I think you're exactly right. But Steve, we were talking right before the show. I was listening to Jimmy Kimmel. I think it was Friday night, when the
and you love Jimmy Kimmel. And actually, he's pretty funny.
He is actually funny, and he's very conscious and thoughtful about what he's doing. So I think that's another help with he has been a fairly vocal voice in the media and celebrity. But he was saying, the CDC relaxed its guidance for masking, and they had done, I'm just paraphrasing obviously, and the delivery won't be the same, but they had done all the research, they gathered all the data, they did the analysis, and they came to the conclusion that nobody was really listening to them anyways. And so I think it's important.
The things we say, maybe.
That's right.
So isn't that the program you were on very early in the pandemic? Weren't you on Jimmy Kimmel Live?
For a very brief
moment?
Yeah,
okay,
I was sandwiched between Stevie Wonder and Paul McCartney.
Well, that's a pretty good couple.
But I think that's important to know, and mostly for you as an individual. We've really been touting and talking about this. You as an individual or your individual bubble. If you feel unsafe, it's always okay to go wear that mask in those public
And I think
spaces.
that, Jesse, at the end of the day, that's really the key. If you feel unsafe, or more importantly, if you are unsafe, because these masks, the masking guidance, again, people have taken it as carte blanche. I don't got to wear a mask anymore. This is the best. Not what the guidelines said. Doesn't say that for Wyandotte. Doesn't say that for Jackson. It really doesn't say that if you have underlying chronic disease, if you're over 65, all these long lists of things that apply to what puts you into that higher risk category. Now, the good news is, as we pointed out, you pointed out just a minute ago, and the New England Journal of Medicine last week had several articles addressing this. Vaccination really, really works. You get those 3 shots.
That's the other key.
Then you have that T-cell immunity.
Yeah.
It looks like it's going to keep you really well protected, even against the variants, because people in our hospital who have come in and who've gotten really sick and who are dying are either the unvaccinated, that's the biggest proportion. We need to share these statistics. Yeah. The unvaccinated is the biggest proportion. Then the next group is those who have been vaccinated, but that's been a long time. They never got their booster or they only got 1 shot. So technically, you're really not all the way up. But if you've been fully vaccinated and boosted, you're just not dying in our hospital from COVID-19.
And I think as we're seeing these cases decrease, I think the other key to this is we are actually now seeing increase in supplies of those outpatient oral therapies, but also increase in supplies of those monoclonal antibodies as long as those monoclonal antibodies work. And so I think that's another thing that moving forward we are all optimistic about.
And the last thing that came out over the weekend was that if you have gotten sotrovimab or a monoclonal antibody, that's great. But if you got Evusheld, which is the injection, the dosing for Omicron needs to be twice what they thought it was initially. So if you've already gotten Evusheld, talk to your physician, because it means you need another dose. Going forward, we're going to be giving you the higher dose to make sure you're protected against Omicron and all of its variants.
Yeah, exactly.
Any reporters on the line today? Think we are good. Okay, great. Now we can move on to our guest and Dr. V, who's sitting right here to my right. So we're going to talk to him here in just a moment. Good morning, by the way.
Morning.
Good to see you. Okay, our guest this morning, joining us virtually, has spent his life playing some of the most memorable characters. You know his voice, you know his face, but you'd think a heart valve replacement and a collapsed lung would slow this guy down. Well, it didn't.
I'm going to put it right on the line.
You know that face.
There've been a lot of complaints already.
How did you get a bonus?
I definitely see a shadow. I'm in talks with Nickelodeon for a cartoon show.
Yeah, I'd watch that.
Sure.
Me too.
Sounds like a good balance.
And you certainly recognize the voice.
I do this voice. I've been doing it for years, the Flying Dutchman.
I am the Flying Dutchman.
Oh, that's
But actor Brian Doyle Murray's recent role took a more serious turn during COVID.
My ear, nose, and throat doctor noticed something.
That something landed Brian in the hands of the cardiac team at the University of Kansas Health System.
They snaked something up my artery up to my heart.
Later, a collapsed lung led to more time in the hospital. Still eager to get back to work, Brian announced he was headed to record at a local studio, when his doctor said, "I don't think so," and offered a safer idea.
I call him a problem solver because he said, you know what? We have a professional grade studio downstairs. I get wheeled down the hallways with like 4 nurses with carts with all these machines on it. And we go zipping down into elevators and down hallways, down to the studio.
It was right here inside the Dolph Simons Jr. Family Broadcast Studio where Brian recorded his voice for his Flying Dutchman character on SpongeBob SquarePants.
And I'm there with my headphones on. We knocked it off in a half an hour. The nurses thought it was fun, and the guys in the studio, it was a break from doing COVID reports and other kind of grim news. I get so public and little.
That's little squirrel of yours and
So between a little work, rehab, and fun, Brian is getting back to his old self.
I feel great. I'm playing golf like twice a week. I'm doing my cardiac rehab.
His advice, to trust that inner voice when it comes to your health.
As you get older, you have a point when anything medical comes up, you have a choice of, okay, is this it? Do I give up to this, or do I face this? And this is just another step in life, and go on.
looking good.
And he's looking good this morning. Brian is joining us from his home here in Kansas City, joining us along with his thoracic surgeon, Dr. Nirmal Veeramachaneni. Good morning to you.
Good morning.
Nice to see Brian. Doing
Absolutely.
well, right? Good to see you. Brian, I'm going to start with you. Just how are you feeling? How are you doing?
I'm feeling great. I'm amazed at how good I feel. I'm working out with a trainer 3 days a week for an hour at a time. And the days I'm not working out, I'm doing my own cardiac on a treadmill and a stationary bike. And just waiting for it to warm up a little bit to get back on the golf course.
That's what I thought you were going to say. So go back a little bit and walk us through this recent health journey that you went through during COVID. So you had this, you had an aortic valve replacement, the TAVR procedure, and then you said that went off pretty well, and you went home the next day. But then you were back in the hands of Dr. V. So just kind of tell us what led up to you coming here to the health system.
Well, I found it all out. I had an appointment with Dr. Kraft, my ENT doctor, who doing one of those CAT scan or MRI, one of those things, and she also found that there was some problem with my carotid artery, and they were going to take care of that. And then my heart doctor, Dr. Hegde, said, "Wait a minute, I think we got to check this murmur you got." And he said, "Oh, that's got to be replaced before you do the carotid artery." And so Dr. Muehlbach and Dr. Tavers, most congenial guys in the world, they explained it to me, so even I understood it. And I went home the next day. It was so easy. It was just remarkable. I couldn't believe it. They didn't cut me open or anything like that. They just snaked something up from my groin up to my heart and replaced the valve. And I went home the next day. And then about a month later, I think, I had a spontaneous collapsed lung, which happens, I guess. And Dr. V took care of me, and it was amazing. The nurses there were just the best. And that's when I had to go do a studio session. On Dr. V's suggestion, I wanted to take out a school, and he said, "No, you can't do that." And he directed me to the downstairs studio, and it worked out great, and they were totally happy with it. And I think the nurses and the guys down there in the studio had a good time too.
Oh, they certainly did. I told you, Brian, we're a full service hospital. We take care of your heart, your lungs, your voiceover needs. You name it, you've got it. And is that your cat?
That's one of my cats.
So I want to bring in Dr. V because I know that I kind of give him credit for being the one as to why you really would sit down and talk with me, because I know you have such a mad respect for Dr. V and how he took care of you. So tell us a little bit about when he said a spontaneous lung collapse. That sounds very serious to the rest of us. He seems to be taking it in stride. Tell us what happened.
So some people will collapse their lung. We often see it in teenagers and people in their early 20s.
That happened to you?
17 years old.
There you
Running
go.
track. Boom, there it goes.
And it's usually in very tall, slender folks, just like Dr. Stites here.
Yeah,
so
I missed on the young part, though.
And in 2022, we're also seeing a lot more people who vape and who smoke a lot of marijuana. So it's actually...
on the rise?
Yes. So I'd say every few weeks I get called down to the emergency room for somebody who, and it's usually some teenager, and you get the parents out of the room and ask them, "So when was the last time you smoked pot?" And they'll tell you, and that's usually what precipitated. I think all the physicians in the room have had the same experience. So it's an unrecognized epidemic.
To be clear, I wasn't smoking pot.
Okay,
when I-
that was my next big question.
Yeah, just
right when it happened.
Putting it right up.
And Brian, I assume you weren't either.
No.
But
Not lately, no.
so
fair enough. We get
with
you.
Brian, the health story, if I can take it back a little bit, I think it actually goes back to 2017 with him. So in 2017, he enrolled in our lung cancer screening program, and I think that kind of set off a whole cascade of events for him. So our nurse practitioners evaluated him, and when we did the screening, and this is an important thing that we can do to decrease mortality from lung cancer and a lot of other diseases. So the current guidelines are, if you are over the age of 50 and you've smoked at least 20 pack years, you really should talk to your physician about enrolling in lung cancer screening.
That was my next question. What can get you into this program?
So the current guidelines have changed, and they're meant to be a lot more inclusive, and they're meant to target some of our more vulnerable populations, especially women. They tend to not smoke as much, but they are at increased risk for lung cancer, and also they perhaps have the most to benefit from early intervention for lung cancer. So the current guidelines are, if you are over the age of 50 and you have smoked at least 20 pack years, that means here's where the algebra gets a little confusing. So you might have smoked 2 packs a day for a couple years, or half a pack for 10. So your physician has to do the math to make sure you're eligible. And if you have not quit within the last 15 years or still smoking, you have to meet all 3 criteria, then you can come in for lung cancer screening. And what that means is you get excuse me, I lost the earpiece, a very low dose radiation non-contrast CT scan that literally takes under a minute. And it can be life-saving. People have shown that if we can detect cancer, you can actually decrease cancer-specific mortality by 20%. No other screening regimen is as potent.
We get so many questions on the show about how can I get into lung screening early? How do I know what's the earliest and best way to detect it? How do I know my family history? So it's a big question.
The current data are it's all based on smoking history and age.
All right, so Brian, I do have to ask you that question. Is you're a smoker? You were a smoker. Tell us a little bit about your smoking history.
Well, I started when I was 11 years old, believe it or not. And I've been asked why I started when I was 11. Well, so I could look 12, that's why. And I smoked basically for 48 years. If I wasn't in the shower or sleeping, I was usually smoking. And I quit, I think, over 16 years ago. And it was probably the best thing I ever did.
How hard was it to quit?
It wasn't easy. It was not easy, but I did it. And I feel a lot better because of it. And I think it caused some, problems in later life if I had known that. But back then, everybody smoked. It was, commonplace. In my own home, if you were 15, you could smoke at the table after dinner. And they didn't know I had started when I was 11, when I was working up at the Caddy Shack. It was just commonplace then. Everybody smoked, it seemed like.
Well, you're right. I grew up in a house of smokers, and people smoked around me and in the car and at home. It wasn't even thought of. I mean, you wouldn't even see that today, but you're right. After 48 years of smoking, though, Dr. V, people say that the day you stop smoking, you start to do that repair. Is that still the case?
Short answer is yes, but all of us are born with perfect lungs, and over a lifetime, things deteriorate. By smoking, you hit the accelerator on the rate of descent. By stopping smoking, you can kind of slow it down, and things get better. Risk of cancer will certainly diminish after about 15 years or so, but some of the other issues with long-term smoking still continue. For example, people have heart disease. So when Mr. Murray enrolled in our program, one of the first things our nurse practitioners did was we referred him to a cardiologist because we noticed signs of heart disease, which then gets you in touch with the right physicians to continue to monitor your health care over time.
I think it's fair to say that it's kind of like wrecking your car. You may fix your car, it may never be the same car. And your lungs are like that. Your lungs are a little bit vulnerable. They're always around all the outside air, all the pollutants, etc. And I think it's important to recognize that whether you're vaping, as I try and teach, families and everybody about that, no, that's not so good either, or smoking, you are going to do damage to your lung, and your lung will never repair itself back to normal.
And the Dr. Stites, Dr. V connection is you send your patients, many of your patients, to Dr. V. Is that correct?
If I have a lung cancer or something that it needs a surgical thing, this is the guy.
That's the guy to go to.
He does a great job. My brother had a lung transplant at UT Southwestern, and then had a lung cancer in his remaining lung, and Dr. V took it out. So he did a great job.
Question for Dr. V and Brian. When you say, again, I keep going back to a collapsed lung, that just sounds so darn serious. Yeah. How did you know that there was something wrong? How would someone know if they were having a collapsed lung? I want to ask you, but how did it feel, Brian, at the time? How did you know you needed to get help?
Well, you're short of breath. You can't really breathe. You know it. I knew it because it had happened to me twice before. It happened to me when I was around 40, I think, a spontaneous collapsed lung. And so I recognized it immediately. Then it happened about, 20 years ago. I had a bicycle accident, and I cracked 8 ribs, and it pierced my lung. And so I had it then. So I recognized right away what it was. I knew that it was a collapsed lung, and got to the hospital right away.
Brian seems pretty in tune with what's going on with his body and when to get help. Anything people listening at home need to know about if something like that were to happen?
Yeah, it's basically seek prompt attention if you're having chest pain, feeling short of breath, getting winded, feeling a pressure-like sensation. And Brian's well in tune with it, and also we've looked at his CAT scans together, so you know that with smoking, your lungs get stiffer, and I think you were just sitting and watching TV around 10 o'clock at night when this happened. Is my memory correct?
Nothing provoked it. It just was there all of a sudden, and I recognized it.
So I have to ask, other than him wanting to escape the hospital to go back to work and do his voiceover for SpongeBob, has he been a pretty good patient?
He's been fantastic. and I greatly appreciate your willingness to come onto this program and just talk about lung cancer screening and demystify it. There's so much stigma associated with lung cancer and the fact that people think that they did this to himself. But Brian's a good testament that, people start smoking who are now in their 60s way back when they didn't know better and it was socially encouraged.
And now they've stopped.
Right. But you still have the consequences of it. So my goal, if anything, is stop having the stigma about it. It's okay. And but more importantly, what can you do right now to make yourself better? You can quit smoking, and you can also come in for lung cancer screening and not ignore a potential risk.
Brian, how's your quality of life changed in the last 16 years since you quit smoking? Like I said, I know you're out there on the golf course and you're active and you're working. How is your quality of life?
It's improved tremendously. I still have the COPD, and I will have that forever. But by working out and doing the cardio, I can handle it. For now at least. I don't know, but I feel good. I can't believe how good I feel, and I'm so grateful to Dr. V because he's the ace guy. In fact, all the doctors I had at KU Med were aces. He and Dr. Tadros and Dr. Milback, they're top of the class.
So can we just say, and I think this is an important thing to get back to, you mentioned earlier about smoking and relationship and vaping as well. Vaping, people think, oh, it's not as bad. And what I try to tell folks is that, gosh, if you're going to walk into a smoky bar and you take that breath in, and it's like you're just taking in a big breath of really polluted air. That's what you're doing with vaping every time. It may not be the same. You're not incinerating the product like you do with tobacco, but you're still getting really nasty stuff. And the more we learn about vaping, the more we realize it's really almost as bad as smoking.
I would actually take that one step further.
Please.
So with smoking, it'll take you several decades before the damage accumulates and the cancer risk goes on. But when you start seeing teenagers and 20-year-olds who get vaping-related lung injury that is irreversible,
right,
that is a much bigger problem. I think that based on what I'm reading, I would rather walk into a smoke-filled room than a vaping filled room any day.
Yeah.
All right, I want to get to some community questions if we can. And I'm going to ask Sharon and Lou have a very similar question. What if you didn't smoke but were raised around smokers and were exposed to secondhand smoke a lot, which is like a lot of us?
Well, that's considered a risk factor, but the current data does not support enrolling patients in lung cancer screening if they meet that criteria. Part of the problem with lung cancer screening is you're going to find a lot of things in the lungs and on these CT scans, and most of them will not be cancer, but it is going to lead to a whole bunch of additional testing, perhaps surgery, that may or may not be helpful. So the current data is focusing on high-risk patients. And unfortunately, over 40 years, people have looked at getting chest x-rays on yearly exams to see if that can increase your diagnosis. Unfortunately, it doesn't work. The only thing that works is a CT scan. But you can potentially cause more harm if you start screening everybody.
Because that CT has radiation by itself,
Sure.
and that radiation could do damage to the lungs. I think what people have to remember, Joss, is that the lungs are the only major organ, unless I'm excluding skin, nose, mouth, but you're constantly exposed to the environment. Mm-hmm. Even your gut, you can chew on something, and then you take a bite, and I don't like that. You can spit it back out again.
Right.
But your lungs are a pretty sensitive organism because they're designed to exchange oxygen. When you continually put bad stuff into them, bad things happen. Mm-hmm. And I think the lungs they don't tolerate that kind of insult very well. They cause a lot of trouble if you do have it because you end up not being able to breathe, which is generally a problem. And then you can end up with a lot of consequences of that leave you really disabled for life.
Dr. Stites, how much time do I have with you?
You got about 4 more minutes.
That's it?
Yeah, I got to run.
You really do? Okay.
I do.
I was going to try to.
I get to go talk to some cool people upstairs in just a minute.
Okay. We're not cool people.
You are the coolest, actually.
Okay.
Jess.
All right. Angela
But Nirmal's here. That just lowers the bar.
I know, right? Okay, so Angela wants to know what causes the marijuana to collapse the lung? Is smoke?
With that, the usual effect that I've seen with collapsed lung is people, when they smoke pot, what is described is they inhale and then they bear down in Valsalva, which is the kind of bear down, which is I guess that's the technique of how they smoke pot. Can't say I've experienced it, but I think that appears to be the method.
Professional. Is that
Well, I've now have a large group of patients where if you sit down and talk to them, they'll tell you exactly what happened.
Yeah.
This is what happened.
So, but what about people who are using marijuana for medicinal purposes? What does the good outweigh the bad?
Couldn't tell you. It has to deal with the specifics of it. And pharmacologically, in 2022, we have a lot of prescription medications that might be marijuana derivatives. So I'm not advocating everybody go to the dispensary.
I'm not either. It sometimes works, but again, you can get it as a gummy. You don't have to inhale it. And I think the problem in this question is the vaping and the meth, or even the toking. And as a result, it's the method of delivery. For those of you who haven't heard the word toke, that means you're inhaling and smoking marijuana.
Thank you for this lesson.
Yeah, well, I'm old. I've been here for 62 years on this planet, so
Fair enough.
Toking was an old term.
That's fair.
I don't think people use it now.
Okay, so one last question, and then I'll let you go.
Okay.
Fanny has a question, and Dr. Hawkinson, jump in this. Can prolonged HIV be a precursor to lung cancer? Have you heard of that?
We know that prolonged uncontrolled HIV can give you risk of cancers for sure. I'm not sure the specific statistics on lung cancer, but we know that prolonged, untreated, uncontrolled HIV does raise your risk for cancers in general, yeah.
And
have you guys seen this?
Not specifically HIV, but immunosuppression in general. For example, patients who've had kidney transplants and are on lifelong immunosuppression, their risk of skin cancers goes up dramatically after 5 to 10 years. And this is true for a lot of the other malignancies.
And there's a transplant-related lymphoma that can occur into the lung. But I think the real key is if your HIV disease is being correctly treated and your counts look great, your risk of most of those cancers are down significantly. Hawkeye. Those cancer risks are usually to people who haven't had full treatment for their HIV.
Yeah, exactly. It's, again, uncontrolled, untreated HIV. So, We know that, I mean, luckily, you know, and Dr. Seitz, you said you lived through this when it first started. Luckily, we have these great treatments now, and if you get on early treatment with HIV, you can reduce those risks, but certainly uncontrolled, untreated HIV is definitely a risk factor.
All right, Dr. Seitz, I'm
Yes,
going to let
ma'am.
you get to those cool people upstairs.
Okay,
You have a
thank
quick
you.
final thought before we have to go?
Yeah, I do. I do have a final thought. Here it is. Saying I do want to take my mask off, I do want to go back to normal life, means you also have to do it with responsibility. Remember, we said that right from the beginning. We, the people of the United States of America, it's all about freedom with responsibility. So you can have mask freedom, but you have to do it responsible. So if you're still in an area with high disease transmission, lots of hospital admissions, then you have to really think, gosh, I ought to wear my mask a little longer until the numbers really come down. Because the reason ultimately that masking is important is not only because of COVID-19, but because of everybody else who gets sick, just like our guest on the show today. What would have happened if he couldn't have gotten care? And we were in that position just a few weeks ago, where we were so full of COVID-19 patients, we were stopping surgeries, we were couldn't see all of our outpatients, the ED times were really long, we couldn't transfer patients in from outside hospitals. Those things have all gotten better. We're not back to the yellow or green zone. We're on our way, and we're going to get there soon. But just be cognizant, just be thoughtful. Remember, I do want to take off my mask. Means we have to do it together.
Dr. Seitz, Arietta says, thank you for all the guidance you have provided over these COVID years.
You bet. And don't toke.
Don't toke. Get out of here. Go have a wonderful Monday. Thank you.
Thank you.
Hey, Brian, so Dr. Seitz touched on it. What was it like going through this during a pandemic? What kind of wrench did that throw in it or not? I mean, you kind of taken everything in such stride, but I'm just curious if that caused you any concerns.
Well, I do know that I think Dr. V told me that he had a patient that they didn't have a bed for, and they were recovering in the ICU because they didn't have a bed for them because of the influx of COVID patients. Is that right, Dr. V? I think that's what I recall.
Oh, absolutely. It's been an interesting time of juggling patients and getting patients into the appropriate care environment. And our nursing staff has been absolutely phenomenal in rising to the challenge. But it's been a real struggle of limited resources and not being able to do your usual routines.
Yeah. Dr. Hawkinson, Ruth wants to know if any updates on kids under the age of 5 getting vaccinated. Do we have any updates on that at all?
Nope, nothing. You know, we hope that it will be soon. We know that there was a delay because they were just looking at the immune responses. I think that they have applied, but no change. We're still waiting. Hopefully later this spring we'll have an approval and the ability to vaccinate those young kids.
Yes, that will make a lot of people very, very happy, a lot of parents. So what type of care will Brian need moving forward with you? So you just need to keep golfing?
He definitely needs to keep golfing.
Okay.
And keep exercising. And more importantly, continue the lung cancer screening.
Yeah. How was that a game changer for him?
So basically with that, we identified he has bad COPD. So with a lifetime of smoking, the lungs are nice and stiff, they're just less compliant. Think of it like a balloon that you can't inflate or deflate as well. So if you have a collapsed lung because one of those little air pockets bursts, it's because it's been weakened, it's much more difficult to heal. So with Brian, we had to be very unusual in our thinking. So I couldn't treat him the same way I deal with the 20-year-old Dr. Stites or the teenage Dr. Stites who comes in with a collapsed lung after running a race. His lungs are a lot more fragile, and you can't treat it the same way. So that's the main reason he was in the hospital longer with drains that needed to be hooked to suction, and it was just a much more prolonged course, but we got him through it. I think his risk of recurrence on his left side is now really low, but he's still at risk on the right side, on the contralateral side, just because the smoking damage is there. But he's doing all the right things. I mean, physical fitness, keeping the lungs healthy.
Diet? What does diet play?
I couldn't give you specifics, but what I'll tell you is the smoking cessation is the most important. This is data going back 20 years, but we used to think that dietary supplements would be great to prevent some of these. There's a study when I was a medical student, it was in JAMA, that showed that if you took a lot of vitamins and you were actively smoking, your risk actually increased for some. So you have to be careful. So the broad advice is clean living.
Right, and Brian did that 16 years ago. That was the biggest step he took 16 years ago, was quitting smoking. So that's a lot. I know that's the toughest thing. Yes, Brian, please go ahead.
They were talking about smoking pot. I know people that they say, "Oh, I quit smoking," and I said, "But are you smoking pot?" And they go, "Oh yeah." Well, no. When I quit smoking, I quit smoking. And I don't know. Some people don't think that's smoking, but it is.
Well, I'll say,
Well,
I'm glad you brought that up. And my mother's probably watching this show, and she was a long-term smoker. I was so proud of her. Now she smokes cigars. My beautiful mother smokes cigars.
Okay. So with cigars, so you get all of the effects of the nicotine, which causes cardiovascular disease. Then people who smoke cigars, they don't necessarily inhale.
Yes.
But what they do is they increase their risk for head and neck cancers. So pick your poison.
Okay. Are you talking to talk to my mother and say, stop it, Sonny, stop smoking the cigars. I don't know, 74 years old. I don't know if I'm going to get her to quit, but
it's never too late. Everybody is capable of change.
I love that. Right. I love that. So we're going to get to some final thoughts today. And Dr. B, I'm going to let you, I know you've given us some great advice and kind of taken us to kind of a deep dive into what we need to know about our lung health, but just some final thoughts for our viewers as we head out this week.
So the biggest thing I can say is the last 2 years have been challenging for everybody. People have not come in to see their physicians. Routine health maintenance has been neglected, and it's true across the board. So I would say is, now's the time, if you've put off that colonoscopy, if you put off that mammogram, if you put off coming in to see your primary care physician for your blood pressure check, now's the time to do it. The data are the data, and I'll tell you, if I look at how my practice has changed for lung cancer operations, I'm seeing patients who are now showing up at much later stage, where their chances of long-term health is much lower. So, and this is a direct reflection on what's happened in the last 2 years. People have been scared to come into the physician's office, and the healthcare system's been somewhat overwhelmed. So now's the chance to reintegrate. Take care of your health. Get the preventative things that you need to do. Go see your primary care doctor.
And Gretchen just asked if you could repeat the steps to qualify for lung screening.
Okay. So the main criteria as of today are age greater than 50, someone who has smoked at least 20 pack years and continues to smoke or only quit smoking within the last 15 years. So, for example, if you're 55 but your last cigarette was when you're 20, you don't qualify.
Gotcha.
Okay? But there are a lot of people who are at risk. If you're part of the KU health system, we set up best practice alerts for physicians to remind them to get you enrolled and to at least start the conversation. And we try and track these, and this is one of the beauty of healthcare informatics. So we make sure that people get their colonoscopy, get their mammogram, and get their lung cancer screening if they qualify.
Great advice. Thanks for being with us today.
Thank you.
Brian, thank you so much for just letting us use your story to help educate people. And we just want to give a shout out to Nickelodeon as well. They were so great to work with so that we could use some of your footage to introduce you, and they were just great to work with for that. So we appreciate them. And Brian, just what would be your final thoughts and maybe your final advice to people listening today just about being their own health advocate?
Well, since I've been in the University of Kansas health system, I've been very fortunate. My primary care doctor, Dr. Becky Lowry, and her nurse, Tricia, have directed me to the right people for anything that they even suspected was wrong. And that's the main thing to do initially. Go to your primary care doctor. And they've got all the ACE people in their notebook. They know who can take care of you. And I've been very lucky to have their advice and their direction. And I urge anybody who, as Dr. V said, has neglected that kind of initial maintenance to get on it.
Well, again, we appreciate you being here. We hope to never see you and hear again unless you're down here in our studio. We only want to see you on TV and hear your voice, or see you down here in our studio again. And I'm telling you, you have an open invite to come back if you need a studio. Come on down. We'll take care of you, okay?
Right. I like working there.
Well, thank you. It was our pleasure. And yes, the guys loved having you here. I'm just going to sneak one question in. I know you're very shy. And like I said, the only reason I think you're here is because you really wanted to talk to Dr. V and show your appreciation. And I appreciate that. But just lastly, if there was one character that you think you would like to be known by, what would be it? Who do you think kind of sums up your career? You've had so many memorable roles and people love you, but what would be the one that kind of sums you up?
Oh, I don't know. Well, the Caddy Master. Yeah, the Caddy Master. Yeah.
Okay. we got a little.
Yeah.
The guys in the back were like, "Oh yeah." So.
Yeah.
Well, we appreciate you. We'll continue to take care of you. We'll continue to watch your beloved characters and movies, and we appreciate you. And please stay close. Stay in touch with us. You're a friend of the health system forever, so thank you.
All right. Thank you very much. Enjoyed being with you all.
Enjoyed it as well. Thank you. Dr. Hawkinson,
Yeah.
sorry, you got to follow Brian Doyle Murray. What are your final thoughts today?
I mean, there's really no following that, so but I'll do my best. You know,
Okay.
I think going back to Dr. Steitz's words about masking and things of that nature, you know, luckily we are seeing significant decrease in cases, decrease in hospitalizations, decrease in deaths. That's always good. We know the mask guidance has been less restrictive now after the release of the new rules. But I think it's always important to understand that if you do feel unsafe, you don't have to go into those situations, or you can still wear a mask. Luckily, we are hopefully getting into warmer times now where you can be doing things outdoors that will also significantly reduce your risk. And always needs to be said, please go get vaccinated. Be up to date on your vaccines, meaning get those full doses and then get that booster. And really, we just want to see you protected so that you don't have to come into the hospital. And we know that all of those things combine to help reduce your risk of coming to the hospital.
All right, so on this show, you're going to be sandwiched between who was it? Paul McCartney and Stevie.
Wonder.
Now you're
Yeah.
going to be between Brian and some really cute puppies.
Yeah.
Okay, so finally this morning, we've got some puppy love to get your week started. These four-legged little guys, they came to visit some very overworked, some very tired healthcare workers at the health system. This happened on Friday. The Casey Pet Project donated this puppy time to help energize these employees last week. And they normally charge for things like this, but not in this case. So we appreciate that. And more dogs will soon see more doctors and nurses as the health system's volunteer services will work with the organization Pets for Life, offering pet therapy visits to staff, which is a similar service that is already offered for patients. Thank you all again for being with us. We appreciate our guests today as well. Don't forget you can catch our show anytime by logging on to Facebook, YouTube, and also on our Twitter channel. That feed as well. More and more people in their 20s and 30s are now coming down with colon cancer. It was once believed to be mainly affecting older people. It is Colon Cancer Awareness Month, and we're going to talk to one of those younger colon cancer survivors about her experience and why screening is key. Everyone, have a great Monday. We'll see you tomorrow at 8.
Subscribe to our morning medical update and open mics with Dr. Steitz podcasts. Now everywhere podcasts are available.